I was first here in 1957 as a medical officer and came back here in 1961. And in fact, my family and we settled at 15 Akyab Road in the doctor's quarters. And I stayed there until 1992, 31 years in total. All my children grew up here. My wife was a registrar at the tuberculosis control unit. In fact, this is really my second home.
I joined nursing in 1959 and I came to Tan Tock Seng Hospital in 1965 to take up the tuberculosis thoracic nursing certificate, and since then I have been in Tan Tock Seng. The whole area of the Novena area has transformed, has changed. During the time that I was working at Tan Tock Seng Hospital, it was surrounded by kampong and there were cemeteries around close to the Novena. And we used to walk from Malbin Road up the hill to come to work. Or we would come from the Thompson Road area and the passageway, there was a pathway which we go up the hill and come into passing a football field, which is the location of this hospital today.
So I started working here about exactly 30 years ago, somewhere around 1983. And I also remember we used to have some wards in the pavilion wards. And our walk rounds used to start from there and then walk all the way up to the main building, and quite a long distance. And every morning was a good exercise. Those are great times.
Well, I was very glad when NTU decided to form a medical school with Tan Tock Seng or Novena as the medical hub. And they've taken over as the Mandalay Road hostel, where medical students used to stay, nurses used to stay. This will develop into an outstanding teaching institute.
Even more interesting, I think even before the buildings are built, you've already set the expectation that the software needs to be put together. So right now, people are already collaborating, already speaking to each other, already building competencies which are perhaps more important than the buildings themselves.
I'm Nelly Rao. I'm posted at Diversional Therapy Unit of Tan Tock Seng. We do a lot of different handicrafts. So as we go along, we learn from each other. What skill you have, you reproduce, and what I have, we reproduce. And this has given me the strength to carry on when I see that the sales are good and we are more or less helping each other. It is a therapy for us, for both young and old.
I'm Mabel Lee. I volunteer myself at Tan Tock Seng DTU, Diversional Therapy Unit. We come here on every Thursday, and after that, if we have some work to do in our center, we will do some handicraft. If no, then we come to the Renzi here to do volunteer work also. We come and befriend the elderly people. Next time also we will grow old ourselves. We need someone to accompany us. So I feel happy doing this sort of thing.
The group was formed in 2002. We have taken over from the cardiac rehab program from the hospital and bringing the exercise into the community, which is part of the rehab program, cardiac rehab program under phase 4. 80% of the members of the cardiac rehab support group or LAGE are ex-patients. Most members have changed their lifestyle after joining, and their health has also improved.
There must be quite a lot of fond memories. But I would say that in the early days, in those days, what impressed me most was the kampong spirit of this hospital. And I remember we used to have a meeting every Saturday, hospital meeting. And at the end of meeting, the entire staff will gather together at the lunch together, and we had tea together. And you had a chance to interact with everybody. In those days, we were able to almost know everyone quite well in the hospital. And this is the Kampong spirit which has brought us together as a team, as a cohesive unit.